I always wanted to become cardiologist, So, well, actually, when I started my medical studies in Paris, it was in the 60s. I had the chance of staying in the top-level department of cardiology and cardiac surgery in Paris, where the advanced technologies were really moving fast, in these places. I was very keen at developing a top-level research program and also innovative technologies. So I started to open my eyes to the what we can call unmet clinical need at that time. And one of the big unmet clinical need was the treatment of patients with symptomatic aortic stenosis. I did the very first in-man case of balloon dilatation of the aortic valve in September 85. And the result of that was absolutely unbelievable. So this technique was spreading all over the world between 85 and 94 until the moment where came the disappointment. The disappointment came from the early valve restenosis. At the end of 99, I had in my hand a prototype of TAVI valve, which is not so different of the valve that we are using today. We started a huge animal experiment with preclinical animal work, taking the sheep model, and we started implanting these prototypes several times a week, in more than 100 sheep. We are now in April 2002. And we were not really ready to move from the sheep to the man. I was 57 years of age. He was in cardiogenic shock. He had what we can say today, he had all the contraindications to the procedure today. This patient is dying. He will be dead tomorrow. The only thing that would save his life is to implant a valve using the transseptal approach. He has all the contraindications, including a floating thrombus in the left ventricle. It worked out very well. At the very moment the valve was delivered, we could see that the blood was coming back to the patient's face. It was absolutely strange. He turned from grey to pink immediately, and the aortic pressure raised. There was no gradient, no residual gradient, no aortic stenosis. He was able to drink champagne with us after 3 hours after the procedure. We were drinking champagne in his room. It was something extraordinary for us. It was a great, great experience. If we can do something and save the life, improve the symptoms, improve the quality of life, it's a great specialty. This is why I love it.